All right, welcome back everyone to Plant-Based Kidney Health. As always, I'm Dr. Sean Hashmi. My partner is Michele Crosmer. And so, Michele, today's question that came in was, why does the diabetes diet and the kidney diet seem to contradict each other? And how do you end up eating if you happen to have both of them?
This is such an important discussion because, diabetes is the leading cause of kidney failure, and almost half of people with kidney disease have diabetes. And so it's really frustrating and disheartening that it's so confusing and seems to contradict. So I think if you think of, okay, we think of someone who has diabetes, they've been following up with their doctor, they have lab work done, and then they're told, oh, you have kidney disease now too. And whether they go to Google and they're looking up, kidney diet or renal diet, or they're given outdated information, in their doctor's office, both things can happen. But then people look at that information and that's where they see that, oh, white eat white bread and white grain products, white rice, don't eat nuts and seeds and legumes. They see recommendations like that on old, outdated renal diet education. And that's the biggest thing. The reason why they seem to contradict is that people are still getting information on the renal diet that is outdated. And so if we actually go into what the diabetes diet recommendations are, we can see that there's actually a lot of overlap as long as someone is getting up to date renal diet nutrition information. So let's go through some of those things. I think one of the big things for someone with diabetes is they're told, hey, we want you to limit added sugars and refined grains. And those refined grains are going to be, of course, we think of white bread, white rice, white pastas, but things like donuts and cookies and pastries and pies. Those are things for both diabetes and both kidney disease that should be limited or avoided. It is an old recommendation in the kidney disease world that people should have those white grain products. But what we found is that it's so important for people with kidney disease to get more fiber in their diet. And so even though whole grains contain a little bit more potassium and phosphorus than white grains, getting more fiber and a less processed food outweighs the fact that someone gets a little more phosphorus and potassium. Another thing, one, that phosphorus is not fully absorbed and the potassium is not drastically different. Brown rice to white rice could be 100 milligrams potassium difference. There's some grains that, whether it's a whole grain or white grain, there's not a huge difference. So again, that's an old, outdated recommendation. Limiting refined grains and added sugars is important for both diabetes and kidney disease. Of course, eating higher fiber carbohydrates is recommended for both diabetes and kidney disease, like I just said. The other thing is, if we think of the diabetes plate method, so what that plate method is they say, okay, eat half of your plate should be filled with non-starchy vegetables. So things like asparagus, leafy greens, cabbage, bell peppers, cucumbers. Half the plate should be filled with that. A quarter of the plate would be starchy vegetables or some sort of whole grain or fruit or dairy. And then a quarter of the plate would be protein, ideally lean protein sources like fish or chicken, turkey, or eggs, or plant protein sources like tofu, tempeh, edamame, beans. So that's what you see on the Diabetes Association recommendations. So we look at that and say, how does that relate for kidney disease? Of course, we want half that plate to be filled with non-starchy vegetables as well. And you can choose non-starchy vegetables that are higher or lower in potassium based on your individual needs. So you can choose arugula, kale, cucumber, bell peppers, cabbage, asparagus, eggplant, green beans as lower potassium options. And you could choose Brussels sprouts, artichokes, um, you know, broccoli is more moderate. You can choose higher potassium ones as well, depending on your needs. Now, that quarter of the plate that's starchy vegetables or fruit or dairy, again, that can be adjusted for kidney disease. So it could be a starchy vegetable like, corn. It could be fruit in, low, moderate, or high potassium. So that's similar as well. And then the protein source. So of course, this is a plant-based kidney health channel. We are trying to help people get more plant protein options in their diet, but that's the Diabetes Association recommends and has plant protein options just like we do for kidney disease. So that overlaps as well. So you can build your plate to be both diabetes and kidney friendly. The other thing we think of is for diabetes, we're saying, hey, eat nuts and seeds and, beans, which are high in fiber to help you feel full and satisfied and help you prevent spikes in blood sugar after meals. We still want people eating those things with kidney disease. And again, it comes down to the potassium. You can choose lower potassium beans like garbanzo beans, green peas, cannellini beans are all going to be lower potassium. Higher potassium ones would be like edamame or adzuki beans. So you can still, nuts, walnuts, macadamia nuts, pecans are lower in potassium compared to other nuts. So what I really want to do here is take out all these guidelines for diabetes can be relevant for people with kidney disease too. It's just picking the right potassium option based on your individual needs. And then for both diabetes and kidney disease, we want people to be drinking, plenty of water. They can enjoy unsweetened teas and coffee and, unsweetened sparkling waters. We want them to limit or avoid added sugars. And the other thing is, since both diabetes and kidney disease are related to or have an increased risk of cardiovascular disease, then we other things like daily and frequent physical activity and exercise is important for both blood sugar management and kidney disease. We want people to, like I said, reduce and avoid the added sugars. We want them to have a heart healthy diet that's higher in fiber, lower in saturated fat, low in sodium for both diabetes and kidney disease. So I think when we take out and simply just remove the old outdated advice of being scared of individual nutrients like potassium and phosphorus, and we just make sure that that piece is individualized for someone who has both diabetes and kidney disease, then there's not a lot of confusion or contradictions. I can't stress this enough that if you are being told, if you have kidney disease, whether this is a new diagnosis or you've had it for a long time, if you're being told by the internet, your doctor, or your dietitian, or your friend, or family member that you have to switch to white rice and you can't eat brown rice anymore, or you can't eat nuts or seeds or legumes, that's old, it's outdated, and you need to find a new dietitian to work with, a specialized renal dietitian, because that's not the advice that you should be getting. And there's a lot less confusion when we remove that from the equation. I hope that helps you guys. It is confusing, but those diets do not have to butt heads against each other, because we need to help people who have both diabetes and kidney disease, because half the people have both. So thank you guys, and we'll see you next time.
Thanks, guys.